Hello, and welcome to Mechanical Reps Employee Benefits Open Enrollment Meeting for benefits that effective October 1st, 2020. My name is Valerie Liu, and I'm a representative with Gallagher, and we have partnered with Mechanical Reps in order to provide you with quality health care at affordable cost. Open enrollment is a time of the year where you're able to make changes to your benefit elections. You can start enrolling online now, and you have until Thursday, September 17th at the end of the day. Even though your benefit plans are starting October 1st, your deductibles and out-of-pocket maximums still run on a calendar year basis. That's January through December. And you're not able to make changes mid-year unless you have a qualifying event. Examples of qualifying events are things such as a marriage or divorce, death of an employee or dependent, the birth or adoption of a child, gain or loss of employment, or loss and gain of other coverage. You have 30 days from that date of event to report that change to your HR team and supply supporting documentation. Your medical carrier is changing to United Healthcare, and you still have three options to select from. You'll have a base plan, a mid plan, and a buy-up plan. I'm going to start by going over the details of your base plan. It is a high deductible health plan, and the plan name is AE3M. With the high deductible health plan, the only services that are covered prior to meeting a deductible are your preventative care, your wellness exams. Those are all covered at 100%. But the minute you go to the doctor for an office visit or the specialist or urgent care or a trip to the emergency room or even getting your prescriptions filled, you're going to be paying the negotiated contracted rate for those services until you meet the deductible. The deductible on this plan is $6,350 per individual with a $12,700 max for the whole family. Once that deductible is met, then United Healthcare will pay the remaining balance, will pay 100% of anything after the deductible. That's why your annual out-of-pocket maximum is the same amount as your deductible, because after you met that deductible, United Healthcare is going to pay 100% of the rest. And that's for in-network benefits. If you were to go out of network, then that's a separate bucket. And the deductible out of network is higher, coinsurance drops to 70%, and your annual out-of-pocket max is higher as well. Also keep in mind, in-network and out-of-network buckets for deductible, coinsurance, and out-of-pocket maximums are separate from each other. You can't intermingle those funds. Your second option is this mid plan, and it's a PPO plan, and that name is AXKP 308020. So again, your preventative services are covered at 100%. The minute you go to the doctor, because you're feeling sick, it's a $15 copay. For children under the age of 19 on this PPO plan, that's going to be covered at 100%. A specialist is a $100 copay in network. However, it's discounted to $50 if you use a provider in the designated network. Urgent care visits is a $25 copay. Your prescriptions is a three-tier program. Tier 1 is $15. Tier 2 is $40. Tier 3 is $75. And that's for up to a 30-day supply of that prescription. If you're on maintenance drugs, maybe taking high blood pressure or cholesterol on a monthly basis, you can take advantage of United Healthcare's mail order program. And it's convenient because it gets delivered right to your home. You get 90 days of prescription all at once. And it's going to save you some money because it's only going to cost 2.5 times the retail value. So for example, if you were to go to the pharmacy 3 months in a row to get 90-day supply of a tier 1 drug, it'll cost you $15, $15, and $15, altogether $45. But if you use the mail order program, that $45, you will only pay $37.50 as opposed to that $45. If you have an emergency room visit, it's going to be $300 copay, plus you'll have to meet your deductible and get co-insurance after that. Any type of hospitalization, inpatient or outpatient, you have to meet your deductible, and your deductible on this plan is $3,000 per member, $6,000 max for the family. After the deductible is met, co-insurance kicks in. United Healthcare will pay 80%. You're responsible for the remaining 20%. But that 20% has a maximum, and that's what the annual out-of-pocket maximum is. You'll pay 20% up to $7,150. That's per member. The family max is $14,300. I do also want to let you know that that annual pocket max would also contribute to that are all your copays that you pay for doctor's visits and prescriptions. Remember, you do still have out-of-network benefits available, but if you go out-of-network, the deductible is higher, co-insurance drops to 50%, and your annual out-of-pocket max is higher as well. And finally, you have your buy-up option. It's another PPO plan, and the name of it is BCX8, 2500, 100%. So going through that same scenario, preventative services is covered at 100%. Office visits is a $30 copay. Children under 19 is covered 100%. Specialist visit is a $60 copay, but it's discounted to $30 if you use a provider in the designated network. Urgent care is $75 copay. Emergency room is $300 copay. Your prescriptions is the same three-tier program. Tier 1 is $15, Tier 2 $40, Tier 3 $75 for up to a 30-day supply. And the mail order program is same 90-day supply, delivered, and it's discounted to 2.5%, 2.5 times the retail. If you have a hospitalization, your deductible that you need to meet is $2,500 per person. $5,000 is the max for the family. Then co-insurance kicks in, and United Healthcare will pay the rest of that balance. Your annual out-of-pocket maximum is $4,000 per member, with the max of the family at $8,000. So here, the difference between the deductible and the out-of-pocket maximum is the amounts of the copays you pay for doctor's visits and prescriptions. So that's what makes up the difference between the deductible and the annual out-of-pocket max. You do have out-of-network benefits. Again, deductible is higher when you go out-of-network. Co-insurance drops to 70% and a higher annual out-of-pocket max as well. United Healthcare also offers the option of virtual visits. If you're on the high deductible health plan, the cost for a virtual visit is approximately $50. If you enroll in the mid or buy-up plan options, then the virtual visit is no charge, but you do need to see a designated virtual network provider. You also can enroll in myuhc.com/virtual visits. Your dental provider is changing to Principal, and they use the Principal Plan Dental Network. And you have two plans to select from. Your preventative services on the base plan is covered at 100%. Once you need basic and major services, you do need to meet a deductible of $50 per person, $150 max for the family. Then basic services are covered at 80%, and major services are covered at 50%, up to an annual maximum of $1,500 per person. So $1,500, once Principal pays out $1,500 in services for one individual, it doesn't pay any more than that. But it continues to pay it for the other individuals as long as every individual enrolled has their own $1,500 annual maximum. So that annual maximum replenishes every year. This plan also covers orthodontist services at 50%. For a lifetime maximum per person, orthodontia lifetime maximum per person of $1,000. The dental buyout plan, that your preventative services are covered at 100% there. Basic and major services are covered after you meet a $50 deductible per person. $150 is the max for that. Then basic services are covered at 80%, and major services are covered at 50% up to an annual maximum of $2,000 per member. You also have orthodontia services. It covers 50%. Again, that orthodontia is for both children and adult, and the orthodontia lifetime maximum per person is $2,000. Both plans do offer an out-of-network benefit. Your vision provider is also changing to Principal. It is through the VSP Vision Care Network. And for your eye exam, you pay a $10 copay, and that's done every 12 months. Lenses is another 12-month benefit, and you pay $25 copay for your lenses, and then you get a $150 allowance for your frames that you're able to get every 24 months. In lieu of glasses, you can use the benefit for contact lenses. That's a $150 allowance for your contact lenses and a $60 copay for your fitting. Any medically necessary contact lenses that's needed is covered after a $25 copay. You do have the option to go out of network, but your allowances, you'll see, you're able to see on the slide what your allowances are if you were to go out of network. Voluntary life insurance benefit is also being offered through Principal. As an employee, you're able to elect additional life insurance for yourself in $10,000 increments up to a maximum of $500,000, excuse me. The guaranteed issue is $100,000 if you're under age 70. So this is your opportunity. If you've waived this life insurance before, you can enroll this year because we're changing carriers to Principal and still take advantage of that guaranteed issue of $100,000. So that means you can get $100,000 worth of coverage without filling out or providing any additional health questions or health statement of health papers. You're able to also have coverage for your spouse. You can cover your spouse in $5,000 increments up to a maximum of $150,000, and your spouse guaranteed issue is $30,000 if under the age of 70. Now, your spouse can't have more than 100% of what you covered yourself for. Children can be covered in either $5,000 or $10,000 policies. So that guaranteed issue is a great benefit that's being offered this year. Any benefit amounts over the guaranteed issue will require you to provide health information. The only exception to that is if you already had higher coverage with Blue Cross Blue Shield, then Principal will grandfather that benefit amount that you had with Blue Cross Blue Shield and without having you fill out any additional statement of health information. Another great benefit that Principal has to offer is that they allow you next year to increase by two levels every open enrollment without providing any additional health information. So that's a great benefit. So additional resource that you have available is your benefit guide. And on page 8, you're going to see the per pay period cost for all of the benefits that we've gone over today. And that's on page 8, whether you get paid semi-monthly or bi-weekly, all those costs are listed there. Also on the benefit guide on page 9 is my contact information. So you'll have my name, Valerie, my phone number, my email address. So you can reach out to Gallagher if you need assistance for claims, or if you need help navigating through any carrier websites. If you need any general plan information or explanations, we're there to help you with that, or even help you with ID cards. Okay, so once again, you are able to start enrolling online starting now, and the deadline is Thursday, September 17th. On behalf of Mechanical Reps and Gallagher, we thank you very much for taking the time to reviewing this video and learning and getting additional information, important information about your open enrollment process. Thank you very much.